Phoebe Chatuhira has never recovered from the pains of childbirth 16 months after the birth of her first son, Samabaho. Chatuhira's firstborn was allegedly admitted at Mulago National Referral Hospital, Mwanamujimu unit, soon after delivery with multiple complications, including pneumonia, chickenpox, and malnutrition. The multifaceted treatment left the infant with a deep wound on the head that keeps on rotting due to lack of experienced care. According to Chatuhira, the medical personnel at the Mwanamujimu Center discharged her son, urging there was nothing more they could do to help heal him. With limited knowledge of her rights, Chatuhira, a resident of Gaba on the outskirts of Kampala, could do less save by going around in search of aid. But her case is not isolated. According to Moses Mulumba, the Executive Director, Center for Health, Human Rights and Development, CEHAD, government must increase sensitization on the client charter launched last week by Ministry of Health. He also calls for enactment of an Act of Parliament to localize the implementation of the charter.
We need to codify that charter into a national legislation that is passed by Parliament, an Act of Parliament. And there are several ways to do that, because when you talk about the right to health, there are several things that are involved. Patients' rights is just one of the components, but people will tell you about sexual reproductive health rights, which is another component.
We are going to have some posters, for example, which bring out the key areas of focus in our mandate. Then we shall make sure that we move hand in hand. We want to put up a clear complaint management system so that when people have issues or concerns with the health sector, they know where to go, they know which office to go to.
The Ministry of Health Client Charter is aimed at strengthening the demand side of performance and accountability by enabling clients of the ministry to access information on services provided, commitments in service delivery standards and performance, and the client's rights and obligations.
The patients get to know what their rights are through the patient's charters. Because the charters are that what they are saying is that as a hospital or a facility, a health facility, this is what our obligations are towards the patients.
It is after bridging such information gaps that people like Phoebe Chatuhira will be able to pursue justice for their loved ones neglected by an impoverished health system. Zahara Namoli, Oyat Sharon, NBS Television.